I'm Dr. Ken Landau. This is Well Now Doctor. Thank you for joining us. We're discussing vitamin D and vitamin D metabolism and how it's important. But how important it is, we really don't understand. It's said that people are deficient in vitamin D, and almost everybody seems to be deficient. But not everyone's breaking their bones, and as a matter of fact, vitamin D is important for bone health, and the two principal bone diseases associated with low levels of vitamin D, the diseases of rickets and osteomalacia, are extraordinarily rare. Well, if we have such a major problem with the vitamin D, why don't we have problems with the diseases that vitamin D causes? Well, those people who tell us that vitamin D is very important, they sort of have continued to change their story over time. Now it's found that we have vitamin D receptors, not just in the bone, not just in the intestine, but we have vitamin D receptors in cells basically throughout the body. So theoretically, vitamin D might be important in cells throughout the body, not just the bone. It might not have to do with calcium metabolism at all. We know that there's one story with the calcium metabolism, but now we know that the story could expand. And not only could it expand because we have the vitamin D receptors everywhere, it seems, but we also have the story. Remember we said that vitamin D is either absorbed through foods in your intestine, typically fortified foods, or it's absorbed through supplements that you consume, or you make it in your skin. But remember, that's not the vitamin D that's active. The vitamin D has to be activated first in the liver and then finally in the kidney. If it's not activated in the kidney, then it's not going to be effective. And when it's effective, then it's effective in very, very, very small quantities. Well, we also know that it might have what we call a paracrine function. It might be that some of these other cells in different areas of the body, might actually be able to metabolize the vitamin D, since they seem to have, in many cases, the same enzymes that the kidney has. Well, if those other cells in the heart and in the cells in the pancreas and in the colon, in the brain, in the immune system, if they can make the active form of vitamin D, is it possible that the vitamin D story has to be expanded far beyond the bones? Maybe we have to consider a variety of other diseases. Well, we might, and let's take a look at some of those. We know that the vitamin D receptors are present in the epidermis and in those cells from the immune system, the white blood cells that we call the monocytes and the macrophages. They're in the T cells that help protect us. And we know that all of those can activate the vitamin D just like the kidney can. And then the question is there more to the story? And at least as far as medical knowledge at the present time is concerned, we have a heck of a lot more information dealing with the bones. And remember, even at the relatively low levels, when we supplement the vitamin D, we don't seem to do anything more for the bones. So is there any evidence that we can do anything more for those other areas of the body where supposedly people are making all sorts of inferences that if you have low levels of vitamin D, that you're going to have more cancer or more heart disease or more diabetes or more difficulty getting rid of your tuberculosis? And the answer is no, we don't have any greater information. So where can the vitamin D be activated in the body? It can be activated in the placenta, in the vascular endothelium. It can be activated in the immune system. It can be activated in the pancreas. It can be activated in the colon, activated in all of those areas. So let's talk about the heart first. And the real question is, does vitamin D in adequate quantities reduce the likelihood that you're going to suffer some cardiovascular disease? And we do have a variety of studies, none of them very well performed, but we have a variety of studies that show that if you have a really high level of vitamin D in the system, not the active form of vitamin D, but that 25-hydroxy vitamin D that's made by the liver, if we have a high level of that, then theoretically you might have a reduced incidence of dying of heart disease, supposedly by 50% or even higher than that. If you could believe it. I happen not to. I think it's absolute nonsense. We have other studies that show that following people after they've had an angioplasty, if we follow them for about 8 years, if those people have elevated levels of that 25 hydroxy vitamin D, that's an inactive form of vitamin D, that they might have a 55% reduction, more than a 50% reduction in the likelihood of dying. Again, doesn't make any sense. Another study looked at about 980 women, and they had an intake of vitamin D, and they were divided into two groups, either the highest level or the lowest level. And we find that, at least according to that study, those people who had the lowest level of vitamin D had a 50% greater chance of dying of congestive heart failure. Now, here's the problem. Here's the major problem. The major problem is if you look at sick people are going to have a lower level of vitamin D, but that doesn't mean that restoring the vitamin D is going to make them healthy. So the question is it a cause and effect relationship, or is it just a relationship that because of a whole bunch of other conditions that the people have, their vitamin D has fallen, just like if we measure so many other things, we find that sick people have blood tests that show sickness. So if we look at the level of inflammatory markers that these people have, these people with congestive heart failure, these people with angioplasties because of inflammatory disease inside the vessel wall, well, yes, indeed, we're going to find that they have higher levels of C-reactive protein, higher levels of some of the interleukin, some of the different markers of inflammatory disease, but that doesn't mean it's the vitamin D that's causing it, and that's something that's very important that people don't understand and don't realize or care to forget and simply say, well, go take the vitamin D because you have a low level of vitamin D in the system. The vitamin D doesn't seem to have anything to do with the story, but people are making it part of the story, and people are saying that, look, if you have a low level of vitamin D, you're going to have a greater likelihood of suffering from high blood pressure. Well, they quote studies as showing that you have a twofold greater risk of having high blood pressure if your vitamin D level is less than 15 compared to if it's, let's say, over about 25. But those people who have a higher level of high blood pressure also happen to be fatter, also happen to have a greater incidence of cigarette smoking. And we know that those are the kind of conditions that cause a low level of vitamin D. So what is the story? Does it make any difference? Well, they engineered some mice. And they engineered mice to lack the vitamin D receptors on the white blood cells. Those white blood cells, remember we talked about the macrophages and the monocytes. So we can manufacture in the laboratory, we can manufacture the animals to have a lack of the receptors. And when they have a lack of receptors, then that's not like a dietary insufficiency. That means that you get zip. And when you get zip, then there's a potential problem. So they have, in those animals, in those mice, they had increased deposition of connective tissue, they had change in the adherence of cells as they float past the vessel wall, which resulted in more plaque being formed. They had a greater incidence of insulin resistance, and they had more inflammation of the liver. They had more inflammatory mediators, and when those animals were transplanted with monocytes and macrophages that had the vitamin D receptors, those problems seemed to go away. So some people look at that kind of a study and say, well, that shows that vitamin D is important, but that's got nothing to do with reality, because people who have low levels of vitamin D that we measure as low levels of vitamin D don't have abnormalities of their cells. So the relationship is not existent. And then some people say, well, look, diabetes. Diabetes, if you have vitamin D deficiency, you might have a decreased insulin production and you have more resistance of the system to the insulin that you actually do produce, and you're going to have an increased incidence of the metabolic syndrome. And supposedly, if you supplement those people's diets with a combination of the calcium and the vitamin D, then you're going to find that you have about a 30% reduction in the incidence of type 2 diabetes. When you find that children who have type 1 diabetes, they're going to have a lower level of vitamin D. But remember, you get type 1 diabetes because you have an inflammatory disease that affects your pancreas. So remember, we also said that inflammatory diseases are going to reduce the amount of vitamin D in your system, going to reduce the amount of vitamin D floating around, at least the kind of vitamin D that we measure. So we don't exactly know what any of that means. And then it said that if you have low levels of vitamin D, you're going to have more inflammation of the pancreas. You're going to make more autoantibodies. So they did a study in Finland, and they looked at 10,000 people, 10,000 children. They supplemented them when they were less than 1 year of age. They gave them some vitamin D, and then they followed them for about 3 or 4 more years. And then they found that the incidence of type 1 diabetes was reduced in those children who had received some vitamin D for the first year of their life. Again, what kind of nonsense is that? The study doesn't show anything. It doesn't mean anything. We know that if you look at adolescents who have low levels of vitamin D have been shown in some studies. Adolescents who have relatively low levels of vitamin D have a slightly higher level of fasting blood sugar. But again, these aren't randomized controlled studies, so they don't mean anything. We don't have good information that would suggest that any of that has anything more to do with the story of vitamin D than if we look at people who are supplemented with vitamin D, do their bones become any less fragile? The answer is no, they don't. It's quite clearly shown. But then people argue, well, you didn't give them enough vitamin D. You have to give them a whole lot of vitamin D. Well, how many pails full a day do you have to take so that they'll be happy? And then the incidence with cancer. Well, we have story after story after story that if you take enough vitamin D, and if you increase the level of the genetically determined vitamin D in your system, that you have less cancer. Is any of that correct? Well, the answer seems to be, again, no. The American Cancer Society, the official spokesman, scratched their head. They say, I don't understand what the heck these stories are. At least at the present time, there's no evidence that that's indeed the case. We know that there's reporting bias. We know that the studies that were done looking at cancer that just happened to show the vitamin D levels, these weren't randomized controlled. They weren't looking at the vitamin D to begin with. So studies that showed that those people who have low levels of vitamin D have 40% greater incidence of cancer of the colon. Is there anything that can be said that would suggest that that's indeed the case? No, actually not. As a matter of fact, they did a study, a legit study, a randomized controlled study, the Women's Health Initiative, looked at a large number of people, followed them for about 8 years, and found that at least as far as the cancer mortality was concerned, didn't make any difference, didn't have reduced incidence of cancer of the colon or cancer of the breast. Well, they said that, hey, you're not giving them enough. You're only giving them 400 units of vitamin D. You're not giving them 800 units, not giving them 1,000 units. But I think we can say at the present time that studies do not show, legitimate medical studies do not show that there's any implication of vitamin D with the story of cancer. And as a matter of fact, when we look at studies where people receive supplements of vitamin D, it doesn't seem that the incidence of breast cancer changes at all. And as a matter of fact, the studies have shown that cancer of the kidney, cancer of the ovary, cancer of the uterus, the endometrium, cancer of the esophagus, or cancer of the stomach, or cancer of the prostate, just doesn't seem to be involved in the story of vitamin D. Just another red herring. Well, how about musculoskeletal pain? If you have musculoskeletal pain, it's said that you're going to be deficient in vitamin D, and if we give you some more vitamin D, then the pain in your muscles, the pain in your skeletal system is going to be resolved, because after all, we know that people who have osteomalacia, who have real deficiencies in vitamin D, if we press on the long bones, if we press on the breastbone, if we press on the leg bone, then you're going to have some pain. Is the same the story with musculoskeletal pain? Well, if we look at the people in the emergency rooms, if we look at the people who go there because of any number of musculoskeletal problems, we find that the overwhelming majority are going to have some pain when we push on the skin, pain when we push on the skin overlying the bone. And if we draw the levels of vitamin D, they're going to have low levels of vitamin D. But we said already that according to those experts out there, that everybody's deficient in vitamin D. So that doesn't show anything. And as a matter of fact, studies have shown that when we replace the vitamin D, that doesn't reduce the level of musculoskeletal pain. And some people say, well, if you have kidney disease, that's associated with low levels of vitamin D. But kidney disease itself is related to low levels. Just the presence of the disease has nothing to do with low levels of vitamin D causing the kidney problems. And if we look at multiple sclerosis, all sorts of stories about multiple sclerosis. Closer you get to the equator, the less likely you are to have multiple sclerosis. And the further you get away from the equator, the greater your incidence. Only if you happen to be white. But remember we said that if you're African American, that you have a lower level of vitamin D than if you happen to be Caucasian. But if you happen to be African American and you're far away from the equator, you don't have a higher incidence of multiple sclerosis. So what kind of nonsense are we talking about? It's related to the vitamin D level. Unshown, unproven, not a good fit, at least with scientific evidence. Other than saying white people living away from the equator seem to have a higher level. There's a lot that goes on in the system other than the amount of sun that you're not going to get, because as you go further away from the equator, you're going to have less amount of sun, and we don't have major epidemics of multiple sclerosis. So I think we can say that the story with multiple sclerosis being caused by vitamin D deficiency, absolute nonsense. And then granulomatous diseases, well, sarcoidosis, these are conditions that may actually manufacture vitamin D. So the level of vitamin D in sarcoidosis, level of vitamin D in tuberculosis and in certain of the lymphomas is higher, not lower. And then certain kind of infections. We've already talked about tuberculosis and how tuberculosis is an infectious condition, and it's associated with higher levels of vitamin D, and we know that some of those granulomas form vitamin D, but we know that it's an inflammatory disease, and an inflammatory disease, you're going to have less vitamin D in the system overall. So if we look at vitamin D as far as therapeutics is concerned, with the incidence of tuberculosis, it seems like when we replete people with vitamin D, not going to have a change in seroconversion from TB negative to TB positive, and we're also not going to have a decrease in the severity. So again, it doesn't seem to make any sense. It doesn't seem to make any difference. Well, people have said that you get upper respiratory infections more often if you have low levels of vitamin D. Oh, another one. And then they say mental illness. They say if you have low levels of vitamin D, that you'll have a higher incidence of schizophrenia, but only if you happen to be a man, not if you happen to be a woman. I wonder if it makes any difference where you're supposed to have lived. And then they say that, well, they're autoimmune diseases. So the likelihood of developing asthma or wheezing when you're a child might be associated with the level of vitamin D. And there are lots of stories about that. None of them seem to be true. And as a matter of fact, if we look at mothers who have high levels of vitamin D in their children, we know that when the mother is supplemented, the child is much more likely to have asthma when they're about 9 years old, much more likely to have childhood eczema when they're about 9 months old. Does any of that really make any difference? No. Remember, inflammatory diseases are associated with a reduction in the level of vitamin D. So any of the associations of this eczema, the wheeziness, the asthma, appear to not be true. So I think the bottom line on all of this is that at least at the present time, we can say that there's no good evidence that vitamin D is associated to a significant extent with any of these other diseases. And when we talk about all-cause mortality, the likelihood of dying is greater if you have a low level of vitamin D. I think we can say that the evidence for that is extraordinarily poor. Because remember, we're talking about people who are likely to die because they have chronic diseases, because they have cancer, because they have chronic heart disease, all of which are associated with inflammatory conditions, all of which cause the vitamin D to go low, not that the vitamin D that's low is causing the heart disease that they already have or causing the cancer that they already have. So what we need to do is we have to remember that there's more to a simple association than a cause and effect. And then let's talk for just a moment about pregnancy and lactation? Well, when we talk about pregnancy and lactation, we have to realize that the child is going to get the vitamin D not from the sun. Obviously, there's no sun that's going to reach a fetus inside the mother's womb, so it has to be through the mother's bloodstream. And we know that calcium can be transferred, and certain of the vitamin D levels can be transferred. And we know that the level of the 25-hydroxy vitamin D, that's the kind that's made in the liver, is basically going to parallel the mother's level. The 125, the active form, that's not going to transfer through the placenta. But we do know that the placenta and the childhood kidney are able to manufacture the 125, the active form, that hopefully is going to go on and lead to development of the skeletal system. The mother who loses bone just in the course of the pregnancy, in the course of the lactation, is she going to be able to make that up? Probably not. Do we know that the fetal level of the enzyme that's necessary to activate the vitamin D, that level in the kidney and the placenta, is that going to be altered by anything? Remember, in the human adult, in the child, we know that it's going to be altered by a number of factors, and so too is it in the fetus, in the unborn. It's going to be altered by the insulin-like growth factor and the human placental lactogen and the estradiol and the prolactin. A lot of feedback mechanisms to keep the vitamin D story, the vitamin D metabolism in the unborn child relatively normal. When the child's born, gets breast milk, we always talk about how breastfeeding is so beneficial to the child. There's basically no vitamin D in breast milk. So where's the child going to get the vitamin D? Child's not going to go outside. Child's going to have to get the vitamin D either through diet or through supplements. Now, we always obviously suggest, at least in the child, that if the child, especially if the child is going to get just breast milk is not going to contain sufficient amount of vitamin D, and the child is going to have to get a supplement. And the supplement, the amount is a little bit arguable right now, but a child should get a supplement of at least a certain amount of the vitamin D, because after all, the vitamin D, even in the formulas, even in the different kind of formulas we get, relatively small amount of vitamin D, only going to get somewhere between about 40 and maybe 100 units per 100 kilocalories. So if the child has enough consumption, and if they're actually labeled correctly, because remember, when we talked about the milk fortification, we said that there's significant variation in the amount that they actually contain versus what's on the label. So we have an issue here. Now, we know that vitamin D might be important as far as implantation is concerned. When the mother becomes pregnant, then we have to get that placenta in there, and we have the immune system, and something has to alter the immune system so that the mother's body doesn't react against the fetus, and that might have something to do with vitamin D metabolism. We're not certain at the present time. So bottom line is, does vitamin D have a role outside the kidney and the bone? And the answer is, at the present time, there isn't a whole lot of good evidence connecting it to these different organs. So what should we do? Should we screen people? A lot of people going and having vitamin D tested. We know that the incidence of testing for vitamin D has increased dramatically over the past 10 or 15 years. Unfortunately, we don't have any international standards. Even the laboratory tests aren't done very well, at least as far as the reproducibility is concerned. So do we have adequate evidence that it's important to screen for vitamin D? The answer is no. Should you take a vitamin D supplement? Well, we don't have any evidence that it's really going to harm you if you take a relatively small level. We just don't even know what's in the bottle, however, and there's, as you've been reading perhaps in the news throughout the country, we have a lot of the manufacturers of products not putting the product in the pill that you consume. And we also have a fair number of the pills that you consume containing potentially harmful products. So we do have to be careful. What amount of vitamin D should you consume? Well, total amount of vitamin D, if you get no sun exposure at all throughout the course of your lifetime, should be somewhere between about 800 and 1,000 units a day. The tolerable upper level, if you happen to be a baby, and you're between the ages of 0 and 6 months of age, well, the maximal level you should take is about 1,000 units a day. If you happen to be up to a year of age, 1,500 units. If you happen to be in your adulthood, over age 9, probably should take no more than 4,000 units every day. Some suggest that it should be as high as 7,000 units, but that's ridiculous. We know that the RDA, the recommended dietary allowance, for children in the first year of life, probably about 400 units, according to the American Academy of Pediatrics. That's enough, although some people say that maybe we should increase it up to about 600 units. 600 units is what's recommended for people up to age 70, 800 units for people in excess of age 70. It's suggested that you can take your vitamin D instead of on a daily basis. You might be able to take it weekly or monthly, even every 3 months, maybe even once a year. Take a massive quantity. Some people suggest that you could take 50,000 units at a time. Maybe do that every week for the first 8 weeks or so, and then every other week or every third week or every fourth week. Well, is there any good evidence for that? No, not really. And as a matter of fact, some people have suggested you take up to 500,000 units at a time, and it seems that people who take 500,000 units at a time might have a higher incidence of death than the people who don't. So that's probably not a good idea. And then the question is, well, what should we do as far as looking at supplements versus the sun? That's a tough one. It seems that you probably don't need any supplements, and it seems like the supplements that you take as an adult at least are not going to be effective at reducing the incidence of any untoward medical issue, and it seems like the amount of sun that you get will increase the degenerative diseases that you get of the skin, increase the wrinkles, the age spots, and then of course increase the cancer, but not do anything significant to impact on the appropriateness of the vitamin D in your system. Well, what is the appropriate amount of vitamin D in your system, and what kind of laboratory tests do we have? Lots of laboratory tests, and you have to realize that the vitamin D that you get from the skin or the supplements is going to be around for a couple months. The amount of vitamin D that you get manufactured in the liver is going to be around for, well, a couple weeks, 2-3 weeks. And the amount of vitamin D you get, the active form of vitamin D, only going to be around for a couple hours. Testing has been available since the 1970s, but just in the past several years has increased about 15-fold. There are lots of different kind of tests that are available, tests that can be done, laboratory tests that can be done, different mechanisms. So we have the radioimmunoassay, we have the chemoluminescence, we have the competitive protein binding assays, and we have the mass spectrometry. All these different kind of tests, and they all give us different kind of answers, and some of them actually only measure D3, some of them measure D2 and D3, so we have an issue, and there's significant variance. The variance can be as high as 15 to 20 or even more nanograms. Well, if you have a 15 nanogram difference in a test where your level is actually 15, you can see that that's a major variance. Well, it has to do with the reagents that they use in the laboratory, it has to do with the calibration, has to do with the standardization, but we think that there's maybe an underestimate of the actual vitamin D floating around in your system by somewhere between as little as 20% as high as 80%. While the laboratory tests have supposedly been standardized several years ago in 2009, well, we don't have any evidence that we really do have the actual standardization of the test, at least as far as the results are concerned. And different laboratories pick different kind of tests because of cost or because of convenience or because of the turnaround time. So all of those are very important to realize. Well, when we get back to the story is, are supplements beneficial for you? Realizing we don't actually know what we're measuring, and what we're measuring doesn't seem to have anything to do with the fact that you may or may not be vitamin D deficient. But the stories go that, remember several years ago, you should take vitamin E, you should take vitamin E. Vitamin E is going to be good for your heart. Vitamin E is going to be good for your prevention of diabetes. Vitamin E is going to be good. Now we don't take vitamin E because actually we've shown that it doesn't do anything good, and as a matter of fact, it might actually be harmful for you. And remember, we talked about the stories where you should take beta-carotene. Beta-carotene obviously is going to be a vitamin A vitamin, and it's very important that you get your vitamin A because it does the same sort of things that vitamin D does. And it's another one of these fat-soluble vitamins, very important. And as a matter of fact, we don't take the beta-carotene now because it was shown in studies that it can actually, among other things, increase the incidence of lung cancer. And remember the hormone replacement therapy. Everyone said you should take hormone replacement therapy. You should go and do it because if you're a postmenopausal woman, you're going to have a higher incidence of heart disease if you don't take it, and you're going to have a higher incidence of hot flashes and all those other kind of things. Well, now we know that if you take if you take the hormone replacement therapy, as a postmenopausal woman, that it's going to increase the incidence of heart disease, increase the incidence of breast cancer, increase the incidence probably of Alzheimer's disease as well. So we know that it's not going to do anything good. So a lot of these stories that came through the same mechanism as all of this vitamin D story, you have to say, geez, we have a lot of talk, but relatively little information that's as good as most people are suggesting. And as a matter of fact, if it's so important, if so many of us are so low in our vitamin D levels, why can't we just show that taking vitamin D is going to reduce the incidence or the likelihood of fractures? We can't show that, and it has not been shown at the present time. And as a matter of fact, there was a compilation of more than 180 different studies looking at 137 different kind of health outcomes, and all they showed was that if you happen to take vitamin D and you're a pregnant woman, maybe the child has less likelihood of being born with a low birth weight. Anything else? Nah. Well, that's not exactly true. Maybe a smaller incidence of dental caries and maybe more normal thyroid function, but those were highly ambiguous and not really good studies. So when the bottom line comes, do we have any good evidence that you need to take a supplement of vitamin D? And the answer is no. No. The overwhelming majority of the public, the 97.5% of the general public, if you consume the normal kind of foods that appear to be healthy for you, if you go out and get a little bit of sun, it would appear that your genes are going to be the determinant of what the level of vitamin D in your system is going to be. Simple as that. So do we need all the supplements? Nope. Do we have good evidence that you need the supplements? Nope. Do you need enough? Do you need to make your RDA? Yep. And that's relatively easy to do. And anyway, just when you hear medical information, when you hear all these people bandy about how this is good for you or that's good for you, go and look at the rest of the story. And now I think we've talked about vitamin D, and you should by now know that the story is a lot more complicated than simply popping a pill. And when you do pop the pill, we don't know that you're going to get anything beneficial out of it. And as a matter of fact, the more vitamin D you take, the more likely you are, at least according to some studies, to get kidney stones, and the more likely you are, even in some studies, to increase your likelihood of dying prematurely. So when you want to reach for that bottle of supplements, I'd think long and hard. Thanks for watching. I'm Dr. Ken Landau.